LOREN LEGARDA is recognized.
Mr. President, distinguished colleagues, the Philippines has been showing an impressive performance in terms of economic growth. Our growth rate of more than 6% annually, which is one of the highest in Southeast Asia, the growing trust of investors as proven by the increasing inflow of investments in the country, and the upgrade in our credit rating by Fitch Ratings, to name a few, are accomplishments to be proud of. But all of these should also have meaning to our people. All of these should translate to basic services that will improve the lives of Filipinos. One of the urgent things we must attend to affects the children of today and the future of our society: undernutrition. Our nutrition indicators not only lag behind most of our neighboring countries in the ASEAN region, but even when compared to developing countries in Africa. Undernutrition is a direct or indirect cause of almost half of child deaths. Over 29,000 Filipino children below 5 die each year due to undernutrition. This is about 38% of all deaths among Filipino children under 5. While 1 million Filipino children suffer from severe or moderate acute malnutrition each year, 14 of the nutrition indicators show that over 28 million children suffer from undernutrition. This is alarming for both our children and our society as a whole. Undernutrition is not only associated with child survival and physical health, it is also a threat to psychological and cognitive development. The damage is largely irreversible. It not only affects children's physical growth, it also diminishes their learning and school performance. Later in life, as adults and professionals, they would have lower productivity and their earnings would be reduced by half. The negative impacts of undernutrition erode the most basic foundation of economic growth: people's strength and energy, creative and analytical capacity, initiative, and entrepreneurial drive. It is unfortunate that we did not reach many of the targets in the last two Philippine Plans of Action for Nutrition, covering 2005 to 2010, 2011 to 2016. Further, we did not achieve the food and nutrition security goals of the Millennium Development Goals. The joint assessment of the Scaling Up Nutrition movement also reported that key challenges in implementing the plans of action for nutrition and achieving our target outcomes include weak political commitment at both the national and local levels, and limits in using a proper nutrition lens in developing and implementing regular and specialized programs by key player agencies. All of these should compel us to work even harder together across all sectors to mitigate this issue. The Department of Health, with UNICEF, and the National Nutrition Council published 2 reports on the economic implications of the status of national nutrition, as well as a business case for nutrition investment in the Philippines. According to the first report, the Philippines is losing and will continue to lose around $4.5 billion per year if current rates of undernutrition are not mitigated. In 2015, this loss was equivalent to around 1.5% of the country's GDP, which has made a significant dent in the national economy. The report presents a case for investing in nutrition in the Philippines and outlines evidence-based and nutrition-specific intervention packages to address nutrition concerns in the country. Apart from posing grave survival and health risks, undernutrition impacts serious human capital development deficits that result in lower work productivity and earnings. The report estimates that the total economic burden emerging from the various cases of undernutrition is estimated at around 220 billion pesos annually, equivalent to a 1.5% loss in our GDP in 2015. Adult productivity deficits caused by childhood stunting and micronutrient deficiencies entails the greatest loss from undernutrition, which reaches more than 150 billion pesos every year. Stunting alone contributes to more than 50% of the economic costs of undernutrition at 115 billion pesos or $2.3 billion. Beyond our moral obligation and humanitarian imperatives, the high economic cost of not doing anything to lift the burdens of undernutrition in the Philippines should compel and drive urgent action. By investing in the available, effective, affordable, and equity-focused nutrition, with 90% coverage of all interventions, we can reduce the burden of national undernutrition by more than 78 billion pesos per year. In short, addressing the huge economic burden of undernutrition is highly cost-effective for the country in the long term. If implemented over the next 10 years and costing only around 5.7 billion pesos per year, this suggested strategy can yield very high returns and an attractive cost-benefit ratio of 1:12. This means every 50 pesos investment in these interventions can save around 624 pesos in foregone earnings or in health expenditures because of undernutrition. Mr. President, as legislators and representatives of our people, we owe this to every Filipino child, to every Filipino citizen. As Congress has the power of the purse, it is incumbent upon us to ensure our citizens are able to benefit from the economic success we now seem to be enjoying. Only then can we help this administration fulfill the promises made to the Filipino people. Incidentally, my office already received last night the President's budget message for 2019. And the budget theme for next year is building a bright future for the Philippines and its people. As the Committee on Finance shall soon commence the task of reviewing the 2018 budget and scrutinizing the proposals for next year's budget, we will make sure that human capital development, starting with the need to address the problem of undernutrition, will be the main component of the government's strategy in securing a bright future for our people. I want to emphasize that strong government commitment and strategic budget allocation at both national and local levels is highly critical. The Department of Health, the NNC, many other line agencies such as the Department of Agriculture, Department of Social Welfare and Development, the Department of Education will all need to invest in evidence-based nutrition-sensitive interventions to target nutritionally at-risk populations or areas in their program activities. Particular attention should also be given to underserved sectors such as indigenous populations, poor families, families with children with disabilities. It is only this way that we will be able to provide equitable services to all Filipinos. To respond to the alarming situation of undernutrition, the Philippines has adopted and approved the Philippine Plan of Action for Nutrition 2017 to 2022. This is very much in line with President Duterte's 10-point economic agenda and the promise of a long-term strategic development plan. The All for Health Towards Health for All agenda of the DOH is an integral part of the PDP 2017 to 2022. This plan of action concretizes our commitment to pursue the Sustainable Development Goals, particularly number 2, which seeks to end hunger, achieve food security, and improve nutrition. It also recognizes the importance of the first 1,000 days of the life of the child as the most critical window of opportunity to avert malnutrition and allow for optimal growth and development. We have to sustain the momentum we've gained in the economic progress we've achieved. We need stronger political will, accountability to ensure effective, strategic, equitable implementation of our plans of action to address the pressing issue of undernutrition among children. The proposed package of the plan of action also relies on strong and motivated community workforce, such as the barangay nutrition scholars, barangay health workers. They need to be adequately supported by our LGUs and provided with the needed tools, skills, attitudes, knowledge to be able to do their job well. We need to empower them, and one way to do this is to rethink our publicly funded plantilla posts. Let us remember that they too have families to feed, children to send to school. Finally, being identified as a priority legislative agenda item in the Philippine Development Plan, the proposed provisions of Senate Bill 383, strengthening of the Barangay Nutrition Program that we filed at the start of this Congress will ultimately address the many critical policy and capacity gaps in the Philippines. I enjoin my colleagues in this chamber for support and approval of this measure. Distinguished colleagues, it is high time for our government to start investing in its biggest, most important resource, the Filipino people, our children. Let us invest in long-term solutions that will allow us to harness our economic progress more strategically and effectively with our people at the heart of our work. It is high time for us to invest in every Filipino, starting in the early years in the first 1,000 days of a child's life, so we can leave a definite, brighter future for this country. Thank you, my dear colleagues.
Thank you, Mr. President.